Hey guys, in this video we are going to talk a little bit about women's anatomy. We're going to do a little 101 quickly because we can't ignore the fact that we've had babies. We can't. And the sooner we acknowledge what's going on in our body, what we need to do to strengthen ourselves, the better runners we're going to be. So I always am going to start with a bit of an anatomy lesson here. So again, what we need to worry about after having kids is our pelvic floor, right? That group of muscles that holds your bladder, holds your bowels, holds your intestines, carries the weight of your baby when you're growing that baby inside, and it stretches up to 3 times its size when you're pregnant. So when you're running afterwards, if you haven't taken the time to reconnect to that core to strengthen it back up again, you're going to be having issues with your pelvic floor. Most of us do. Excuse me. It also helps to stabilize and support your spine, which is really important to know. It's why there's so much back pain after pregnancy, why there's so much back pain with running after pregnancy. And then we have our abdominals, right? That six-pack, that flat tummy that we all are going for. Again, when we have babies and that baby's growing, those tendons and muscles actually pull apart, leave you with a gap in the middle. When that baby's gone, you're still left with that gap in the middle called diastasis recti. So we're already left in a weakened position. Combined with pelvic floor weakness, we're at a really high risk of injury, and it makes running really difficult postpartum. There are lots you can do, and this running form series is perfect to help you reconnect to your core, to re-strengthen. What I want you guys to be aware of, because those are totally other videos and webinars that I'm going to do or that I've done in the past. Email me if you have questions or you want to get access to some of that information, because I have it. But what we're going to focus on today, what I want you to be aware of are the signs and symptoms that these are issues for you. So let me make sure I don't forget any here. Low back pain, pelvic area pain, hip or knee pain even, chronic pain, chronic injury that doesn't seem to be resolving, leaking during workouts. If you're peeing your pants during your runs and any jumping activities, when you start to sprint or do interval workouts that are harder, if you have the urge to pee a lot but not much comes out, a heaviness or a bulge in your vaginal area when you're running or jumping, if you have an outie belly button where there wasn't one before, a bulge down your midline when you're doing a crunch, which I don't want you to do, but if you try it and you have this weird bulge, alien kind of thing all the way down, it's a sign of a diastasis recti. And maybe you look pregnant when you're not. Those are all signs that you guys need to be watching for. And always seeing a pelvic floor physiotherapist if you're concerned about these. I'm going to post a link to a little bit more information on diastasis recti and a self-administered test you can do to see if you have it. It's important to know if you have it and then if you're symptomatic. Excuse me, some people can have it and they're not symptomatic, so all you need to do, work on your form, work on your core, strengthen it, connect with it, and get stronger. See you in the next video.